we have virus-infected cells. We have the immune system that's coming in to try to clean up these virus-infected cells. Now, we are going to experience symptoms of this infection. The reason why we experience these symptoms is obviously because of the immune reaction. So let's talk about a couple of the symptoms, and we'll talk about why these happen due to our own immune system. Okay, one of the first things we're going to experience is fever. So with fever, you see that people are going places, that's the first thing they're checking. Do you have a fever? Because some people can have a fever and not even know it. You may not even feel feverish, but that's the reason why we're checking with thermometers to make sure that people don't have fevers. Okay. Why do we get a fever? We get a fever because that's our body's natural response and way of clearing out pathogens. If we can heat it up, we can degrade the proteins and we can break them down. So that's the whole point of heating up and getting a fever, is if we really heat up that body, then those proteins that are on the outside of the virus can degrade and break down a little bit so that it doesn't have the ability to hijack our cells, right? Because if we catch it, if it's circulating and we can heat it up, then what happens is all the RNA that's inside this virus goes out into the bloodstream. The RNA can't actually get into our cells, so it can get cleared up. No big deal, right? So that's the reason why we're going to have I had a hair. That's the reason why we're going to have a fever. We're going to have a fever because we want to heat up the virus. We want to basically denature those proteins. We want to break it down, okay? So we're going to have a fever. That's a natural response. One of the things that some people will do is they will medicate a fever. I don't know how... I know that we're seeing that ibuprofen is not the best thing to take in patients with COVID. And most of the time people are going to take ibuprofen if they have a fever or there's pain or anything like that. So one of the things that we're finding is that that's definitely not a good idea in certain cases. I wouldn't recommend taking any ibuprofen. I wouldn't recommend, if you have an active COVID infection, to take elderberry either, because elderberry is a natural cytokine accelerator, and so we can actually cause more problems. More of these symptoms can be amplified, and we're going to amplify that that inflammatory cascade, and we definitely don't want that. That would make symptoms worse. So that's what we're kind of seeing. So a fever, as long as it is well maintained, is not a bad thing. That's our body trying to clear this out. So it's trying to do its job. We just have to let it do it sometimes. So a fever, not necessarily bad, but that is the mechanism behind it. It is there for a reason, and that is to help clear out this virus, right? Okay, so we get fatigue. Fatigue is another really common one associated with a virus. And here's why. We are at war, people. We are at war in our own bodies, okay? So when your immune system is completely ramped up and we are working on fighting off this virus, that expends a lot of energy. So any bacteria or virus, any type of infection that we have has a lot of energy expenditure associated with it because the immune system needs a lot of energy to do what it needs to do. So that's the reason why we have fatigue. And I always tell my patients, look, if you have fatigue, that is your body's way of telling you that it needs to do something and it needs you to take a pause, okay? So go lay down on the sofa and take a nap or go to bed early. Fatigue is telling you that you need to rest. And so please listen to your body and take its advice. It needs you to not expend energy in other places so that it can focus on expending that energy toward the immune system, okay? So that's really important, but that's the reason why we have fatigue. The other thing that we're going to get is we're going to get a cough. Now with this cough, A lot of people are reporting that they have a cough for 6 weeks or even more sometimes. But it's this like chronic, annoying cough. It's non-productive, and what non-productive means is that they're not coughing up green or yellow, any kind of mucousy stuff. It's just this really dry, nagging cough. So why would we get a cough in the first place? So I'll give you kind of a similar scenario. When we have, in our respiratory tract, we have, the cells are lined with these cute little hairs, right? And the reason why we have these little cilia in our respiratory tract is if we're breathing in dirt, we don't want that dirt to go into our lungs. That's not a good thing. So it gets trapped in those little hairs, and those hairs push things up, and then we can cough them out through the mouth, right? Really cool. Now, in patients that are smokers, those poor little hairs are damaged, okay? So they're not as efficient at getting stuff out and preventing stuff from getting into the lungs because they have damaged their poor cells. Okay, so what happens is the reason why we get a cough with COVID-19 is because we do have damage to those cells as well. It happens sometimes when we get any kind of other upper respiratory infection. We're going to have damage to those cells, and that's the reason why we develop a cough. Now, the reason why we're developing a cough is when those hairs aren't able to push things up, so we can push them out, then the other mechanism, our backup plan, is a cough, because we use the air from the lungs and push it up so that we can get whatever is stuck here out. Okay, so if we have any damage to any of those cells, then our natural second line is to cough to try to push things out. Now, are we pushing out virus-infected cells? Maybe. We might just be pushing out regular virus cells as well. We might be pushing out mucus because that is a natural process that we are going to produce as part of an immune reaction. So we might be getting rid of mucus, any kind of debris, any blown up cells, like any of that stuff can be pushed out when we're coughing. But we cough so that we can get the stuff out, right? And normally we would have those nice little hairs that would be able to push things out, but when they're damaged, they can't do that. And that's the reason why patients that are smokers have a smoker's cough. And that smoker's cough is because they have permanently damaged those cells and they cannot get things out efficiently. So instead, the backup is to cough, okay? So that's the reason why we get a cough. Now, the reason why we get shortness of breath, why does this happen? It happens because we get fluid and mucousy immune stuff, for layman's terms, in our alveolar, which are these little sacs in our lungs. Now, our lungs have these little sacs that are responsible for moving air from the outside, oxygen, into our bloodstream, and taking carbon dioxide from our bloodstream and moving it out so we can breathe it out, right? So it's for oxygen and carbon dioxide exchange, so gas exchange. Now, when we have fluid in these little sacs, these little air sacs, does it make sense that oxygen exchange is going to be inhibited? Does it make sense that it's going to be difficult for oxygen to get in through the mucus, to get into the bloodstream? And does it make sense that carbon dioxide is going to have a hard time getting out of the bloodstream and out into the air? It's kind of like if you were to be in a swimming pool and you blow bubbles underwater. It takes time for those bubbles to get to the surface. It's not as if you were to take and be out of the water and blow air out. When you blow air out, when you're outside of the water, it goes quick and easy. There's no resistance. But when you're underwater, there's more resistance. So it takes longer. It's less efficient. So not only do we have to work harder at being able to oxygenate all of our cells, because now we're having to work really hard to get oxygen into the bloodstream, but we also have a hard time getting carbon dioxide out of the bloodstream, which can make things very acidic, very toxic too. And then if there's more carbon dioxide that's now on those red blood cells being transported around because we can't get it off, then we have less room for oxygen, and those cells have less oxygen. So it just ends up being a really, really bad situation. So the reason why you're going to have shortness of breath is because we do have that fluid, that mucus, that is going to be produced naturally as part of the immune system response. And that is what's going to gunk up the lungs and make it really difficult.